EFT and EFT community. I'm Veg, and I'd like to share a book that I've just published called Shift Stress for nurses, healthcare workers, and caregivers, and some of the blocks that I needed to go through to shift my own stress. But before I do that, I'd like to tell you a little bit about my own EFT journey, which started in 2008. I'd been working in a large community hospital for a couple of years, and I wasn't prepared for the stories that the staff were coming to share with me. As an occupational health nurse, I was part of a team caring for the well-being of staff. And so what I was hearing was more conflict in the workplace between managers, between co-workers, between patients and family members, and increased violence too, something that I had not experienced when I was a nurse working on the front lines. And I really felt a desire to do something about that and to learn ways that I could help shift the stress for staff that were working on the front lines and their emotional health. So, with that intention, I actually came across a brochure that very weekend, and it was north of about a couple of hours north of Toronto and in Canada, and the brochure was about EFT, and it stated that it was an easy to learn stress reduction technique. And I thought, is this it? Is this what I meant to discover and learn? And so I went back home. I was excited to learn this new technique and signed up for Gary Craig's Level 1 online. And that was 2008. And of course, it wasn't an evidence-based tool back then. So working in the medical model, I felt I needed to do some more training. And back to school I went to become a registered psychotherapist. And the year that I graduated in 2012 was also the year that EFT became evidence-based. And it helped me so much with anxiety, social anxiety particularly, and public speaking, that here I am. And as I'm, nearing my own retirement, I wondered if sharing some of these tools that I'd learned would be helpful and reach more people than I was being effective in my one-on-one sessions. So I began writing in 2017. And so that journey led me to use conscious EFT when I just thought about writing the book, having that imposter syndrome. Who was I to write a book? Who was I not to write a book? And that went back and forth several times before coming to the realization that there's not too many RN psychotherapists out there. And so am I a bridge to get to the medical model and using energy psychology tools? And I knew the EFT community would be in my back pocket with all the peer-reviewed papers. And so I gave myself compassion to have courage when I felt discouraged. And I also felt like shining my light. It wasn't so much the success, but it was about finding my voice, to have that courage. I was someone that grew up with to be seen and not heard. And so for me, it was finding that voice to speak out and speak up, and not to be an observer, but to actually participate. And so I learnt to find that voice, and I'm so grateful for all the teachers that have come across my path, and for all the borrowing benefits that I've had from my clients. And if this book can get into the hands of any healthcare workers, caregivers, to support them on their path, and if you have a way to be able to do that, I would be so appreciated. Thank you.